Welcome to Part 5 of our 6-part video training series, where we discuss fit testing and training. We'd like to thank the following institutions and individuals. Now that we have discussed the prerequisite medical clearance, we can fully explore fit testing and training. Some of the slides in this presentation are very detailed, and you are welcome to pause the recording at any time to review the slides in more depth. By the end of this module, we hope that you'll be able to list 2 things the healthcare worker should do before fit testing, explain what it means if the worker can taste the substance during fit testing while wearing a respirator, and demonstrate how to perform positive and negative seal checks. In this module, we'll review how to prepare for test day, how to select a respirator, and the actual fit test procedure itself. To prepare for fit testing, you should first identify the healthcare workers who will be requiring respirators. Make sure to verify that they have received medical clearance to wear a respirator. Even with medical clearance, not all users will pass the fit test. Some may need to try a different size respirator, which should be done on a different day. Even with a different respirator size, they still might not pass the fit test. You will also need to prepare the fit testing equipment. At the fit testing session, goggles will be needed for people using N95 or half-face elastomerics. You will also need cleaning supplies to clean the fit test hood and the respirator after each use. This can be done by wiping down the inside of the hood and all sides of the respirator with cloth wrung in dilute bleach solution. After 5 minutes, you can wipe down with water and dry. Here is a list of equipment needed for fit testing. Note that water should be available for all users, so that they can rinse out the flavor of the testing solution. If possible, water should be stored in a covered dispenser to avoid contamination. Record sheets are important for documenting the results of the fit test. There are also steps that the healthcare worker needs to take before fit testing. Besides completing medical clearance, they must be clean-shaven and avoid food and water for 30 minutes prior to fit testing. Workers should be fit tested wearing eye protection to ensure it doesn't interfere with the respirator's fit. Finally, healthcare workers will be asked whether they have any current symptoms associated with COVID-19 and have their temperature checked before fit testing. At the site, the healthcare worker should be able to choose a respirator from a variety of sizes. They should try the respirator while wearing their goggles. Make sure that the respirator spans from the person's nose to their chin. Ask them to talk and see if the respirator slips. There's a special way to put on or don respirators. First, adjust the head cradle size as needed so that it fits comfortably on the head. Next, place the respirator over the mouth and nose. Then pull the head harness over the crown of the head. Then, grasp the bottom straps, place them at the back of the neck, and hook them together. Pull the ends of the straps to adjust the tightness, being careful to not over-tighten. Next, we'll discuss how to perform a positive and negative pressure seal check, which is necessary each time the respirator is donned. As a reminder, if you can't achieve a proper fit, do not enter contaminated areas. Note that the filters in these figures are slightly different than the particulate filter cartridges recommended in healthcare settings. The same principles for donning apply. Users must do a positive pressure seal check every time they wear a respirator. First, cover the exhalation valve. This blocks the air that exits. Then, exhale gently. A successful check is when the facepiece is slightly pressurized. In other words, the respirator should expand slightly. There should be no outward leakage of air. During a negative pressure seal check, the user inhales sharply while blocking the filters. A successful check is when the facepiece collapses slightly under the negative pressure that is created. This is a link to a 7-minute video on fit testing by 3M. Let's watch it now.
When you are first issued a respirator and have learned to put it on correctly, you must make sure your respirator fits properly. As part of a complete respiratory protection program, the Occupational Safety and Health Administration, OSHA, requires fit testing to be conducted at least annually. Prior to being fit tested in any respirator, you must have completed a medical evaluation, which determines your fitness for wearing a respirator. The proper fit of your respirator must be confirmed with a fit test before you wear the respirator in a contaminated atmosphere. This must be done for all tight-fitting face pieces. If you use a face piece with a positive pressure system, it must first be converted to negative pressure prior to fit test. Qualitative fit tests are appropriate for fit testing all tight-fitting respirators except negative pressure full face piece respirators used in environments where the concentration is greater than 10 times the occupational exposure limit. One type of qualitative fit test can be performed with a mist that contains either saccharin, which is a sweetener, or a bitter-tasting substance known as Bittrex. The test process is the same for both test agents. Your instructor will tell you which material will be used for your fit test. This test is valid for any particulate respirator or any gas and vapor respirator with particulate filters. The particulate filters are used so that only face piece fit is tested. The qualitative fit test must be repeated at least once a year to ensure that your respirator continues to fit properly. If your respirator doesn't fit well enough to pass this test, you will need to refit your existing respirator or try a different size or style of respirator until you pass the test. Because this is a taste test, you cannot eat, drink, or chew gum for 15 minutes before the test. The first step is a sensitivity check. It establishes your ability to taste the test agent. You don't wear your respirator for this step. Your instructor will place a hood over your head. It should be positioned so that there is a space of about 6 inches between your face and the hood window. This allows free movement of your head. Using nebulizer number 1, containing the sensitivity solution, the instructor will initially spray 10 squeezes into the hood through the hole in the window. You must breathe through your mouth and extend your tongue slightly. If you taste the test agent at any time during the 10 squeezes, tell the instructor. The taste threshold will be noted as 10, regardless of the number of squeezes actually completed. If you can't taste the test agent after 10 squeezes, the instructor will put an additional 10 squeezes into the hood. If the taste is detected during the second 10 squeezes, the test is completed and recorded as 20. If you still can't taste the test agent, the instructor will add 10 more. If the taste is detected during the third set of 10 squeezes, the test is completed and recorded as 30. If you still can't taste the test agent after 30 squeezes, the test is over. You can't be tested using this material. Once it has been determined at what level, 10, 20, or 30 squeezes, you can taste the test agent, you'll remove the hood and wait a few minutes to clear the taste from your mouth. Rinsing your mouth with water may be helpful. Next, put on your respirator following all instructions for proper fitting, including a user seal check, as taught during your training session. The instructor will place the test hood over your head again and position it so you have about 6 inches between your face and the window. Now, using nebulizer number 2, the instructor will spray the fit test agent into the hood, using 10, 20, or 30 squeezes, depending on the number of squeezes needed to taste the test agent. To maintain the concentration of solution during the test, the instructor will inject 1/2 the number of squeezes used at the beginning of the fit test, 5, 10, or 15, every 30 seconds thereafter. Continue to breathe through your mouth during the entire test. Perform the following exercises for 60 seconds each, as directed by your instructor. 1. Breathe normally. 2. Breathe deeply and regularly. 3. Turn your head from side to side, stopping for a breath at each side. 4. Nod your head up and down, holding at each position for 1 or 2 breaths. 5. Talk. Read the rainbow passage slowly out loud. 6. Bend over. Bend at the waist as if touching your toes. Be sure to hold on to the hood when bending over. You may substitute jogging in place for this exercise. 7. Breathe normally again. If at any time during the fit test you detect the same taste you did during the sensitivity check, inform the instructor immediately. It means that your respirator does not fit properly. You must then refit your existing respirator or select a different size or style of respirator. Once you clear the taste of the test agent from your mouth, you'll repeat the sensitivity test and fit test procedure. If you complete the exercises without tasting the test agent, the respirator fits you properly. You passed the fit test. After the fit test is complete, the hood will be cleaned with a disposable wipe. When it comes to respiratory protection, you must have a proper fit. Your health depends on it.
Here are some of the highlights from the training video. Remember, it's important to ensure that the user can taste the fit test solution. Record if they can taste the solution under 10, 20, or 30 sprays. After the sensitivity test, have them gargle water and wait at least 15 minutes for the taste to go away. Then spray half the number of squeezes, either 5, 10, or 15, every 30 seconds throughout the remainder of the exercises. The user must report if they can taste the solution at any point in the exercise. If they can, it means that the respirator does not fit. Let's now review the exercises. Remember that breathing may be difficult with the respirator and under the fit test hood. The user should be standing for all the exercises. The first step is to breathe normally. The second step is deep breathing, which should be done slowly. Third, have the user turn their head from side to side. They should hold at each side so that they can inhale. Throughout the exercises, spray either 5, 10, or 15 sprays every 30 seconds. This is where the timer comes in handy. In the fourth step, the user should move their head up and down. They should be instructed to inhale in the up position when looking toward the ceiling. In the fifth step, the user should bend at the waist or jog in place. Next, the user should talk out loud, slowly. They should speak out loudly enough to be heard clearly. Lastly, for the seventh step, the user should stand and resume normal breathing, like in exercise 1. Here is a summary of the fit test exercises. You can also review them in the accompanying handout. Let's now summarize some key concepts. Healthcare workers should refrain from eating or drinking water for at least 30 minutes before the fit test. They should also bring their medical clearance forms and be clean-shaven. Users must report when the testing solution is smelled or tasted during the fit exercises. This means that the respirator does not fit them. Lastly, positive and negative seal pressure checks must be performed every time a respirator is worn. Here's a list of resources related to fit testing.